World AIDS Day was held December the 1st. Also on that day, an AIDS awareness seminar was held at the Cookeville General Hospital.
We are here today to remember those who have passed on from this deadly disease, to promote continued awareness of the needs of those who are positive for HIV now, and to educate everyone on how to prevent this deadly disease from occurring in your life. This time last year, when we had the first AIDS Day, World AIDS Day, Dr. Kathy Bertram and I were in San Francisco, and we were able to visit the NAMES Project headquarters. And I don't exactly know what I expected, but when we walked in, there was people working, but I noticed it was very, very quiet, and we looked up at the panels, and each panel represented one individual who had died from AIDS. It made it very personable to me, and we just stood there and looked at them. So we came home with the idea that we would make a panel to represent the people in our 14 counties who have died with this deadly disease. We went to the local AIDS support group. We asked for them to come up with a design. They did a beautiful job. We took it to our quilt group, and we said, okay, ladies, we're going to do this. And we did. And this is the project. We hope in October 1996 it will be in Washington, D.C. with over 26,000 other panels. And we all plan to go. But this panel will be put with several others to make a whole 12-foot by 12-foot panel that will travel throughout the country. So it's unusual to get to see one by itself, but since this is out from us to our community, we wanted to share it with you today.
It's estimated that there are approximately 18 to 20 million people worldwide who are infected with HIV. And the CDC just recently released a report that since 1981 in the United States that 500,000 cases of AIDS have been reported, and over 300,000 of those people have already died. Now, when you hear these numbers or see them on paper, sometimes it's hard to put a face with those numbers or to realize that there are actual people behind these numbers. But it is real people. I am one of those people living with HIV. I've been infected for about 6 years. I became infected in late 1989 or early 90. And I learned that I was infected on October 24th, 1991. As you've probably learned by now, a year ago today, I went public with my HIV status. And I had no idea as to how I would be treated or how people would accept me. But in the days that followed my announcement, I began to receive cards and letters, phone calls from family and friends and even strangers who had heard my story. And they just wanted to let me know that they supported me in what I was doing and that they loved me and that they were glad that someone was finally brave enough, or as some people put it, crazy enough to make such an announcement and to let people know that I am living with HIV, especially in the rural areas. I'm sure it's hard to live with HIV anywhere in the world, but especially hard in the rural areas. And looking back over this past year, I hope that I have made a difference in the lives of people living with this disease and people that have been affected by it.
Your theme, shared rights, shared responsibility, is one that instantly rung a number of bells with me, because there's a sense in which I find myself more and more talking about HIV/AIDS in terms of how it is that it's something that we share. It's something that none of us can separate, divorce ourselves from. It's something that the only way we end up being able to suggest is not a part of our lives is probably to allow ourselves to be guilty of a form of denial. And it's important to understand that it is something that we share.
The panels for the AIDS Memorial quilts are created in sorrow. There is hope sewn into each one. Hope that those who view it will be moved to act. Today, our Upper Cumberland region remembers Jeff, Larry, Paul, Daryl, James, Charlie, Larry, Beth, Cecil, James, Bill, Glenn, Michael, Charity, Kirby, Betty, Don, Tom, David, James, Don, Mike, Mark, Jimmy, Dennis, Kelly, Lloyd, Jack, Paul, Danny, Gregory, Ricky, Robert, Alan, Charles, Chris, Gary, Jerry, Pat, Keith, Randy, Orly, Tommy, Roy, Patrick, Alex, Laurie, Richard, John, Jack, Kenneth, James, Luke, Russell, Margaret, William, George, Donald, Danny, Anthony, Jerry, G.O., Robert, Charlene, Steve, Michael, John, Sherry, Kenneth, Thomas, James, David, Mary, Marie, Jerry, Art, Stephen, C.B., Patrick, Russell, Victor, Justin, and Donnie. Our hope and our goal is the day will come when the last panel will be sewn into this quilt